Electricity and face cream are words you would normally not hear together in the same sentence, but something new on the market combines those two things and promises more youthful-looking skin. Medical reporter Meg Ferris has the experts and before and after pictures on tonight's Wrinkle-Free Friday.
When dermatologist Dr. Patricia Ferris learned about a new kind of anti-aging cream on the market, she asked one of her patients to try it.
My eyelids are definitely smoother and firmer. And to tell the truth, in the beginning I didn't expect drastic results, but after 2 weeks I think I've seen really good results. And it says on the box 4 weeks, give it 4 weeks. So I'm excited about it.
At 64 years of age, Sharon Seegers describes her eyelids as heavy, so she's trying a new product called Neutrogena Clinical, sold over the counter in drugstores. Doctors say this new cream acts in a completely different way than others on the market.
This really comes out of the wound healing literature, which they found that when skin was wounded, it started generating low levels of what we call natural electricity, and this is the way the cells communicate, and it tells the fibroblasts to make collagen to heal the wound, and it also tells inflammatory cells to come in to clean up the damage that's been done. This sort of idea is now being applied to aging skin, and it's really a very innovative approach.
Doctors say the Ion 2 complex needs to be put on the skin first. Then, right after that, the activator goes on. The key ingredients are zinc and copper.
And how do we know that it gets into your skin on the cellular level?
Well, this has all been studied really quite extensively by the Neutrogena Corporation, who holds the license or the patent on the product. And they've done skin penetration studies as well as studied the amount of electricity that's generated by the product.
Dr. Ferris says the studies were well done by the gold standards of scientific testing, where neither the doctors nor the patients knew if they were using the real or fake cream. And she says lab studies revealed a more than 2-fold increase in collagen and an 11-fold increase in elastin fibers that make your skin tight.
Some other interesting findings they found in the preliminary studies were it also causes some lightening of pigmentation, which was actually something that they did not expect, but they were able to sort of shut off the pigment-producing cells, so that was an exciting finding.
Dermatologist Dr. Mary Lupo says there is a new buzz about this so-called biomimetic technology and the theory that it can improve skin tone and texture.
What's interesting is that when you think about it, photo damage or sun damage really is a wound to the skin. It damages collagen and other important proteins in the skin. And the thought of doing anything that stimulates repair by mimicking the body's natural repair mechanisms really makes a lot of sense. Sort of a more natural way to encourage your body to make its own collagen.
Dermatologic surgeon Dr. Bill Coleman, who is the editor-in-chief of the Journal of Dermatologic Surgery, says he believes the product is safe, but doesn't feel the results will be dramatic.
All of the tests of this are done in the cosmetic and toiletry world, where the standard for benefits is very low compared to the clinical world. In the clinical world, for something to really be good, it needs to be as effective as Retin-A, for instance, or something that we know really makes a difference.
And all the doctors agree that you should never get rid of your prescription retinoids, such as Retin-A, Renova, Tazarac, and the green cream, proven to work. Some feel this new cream will make your skin less flaky from the retinoids. But still, some doctors feel the studies were reputable and will recommend using the new Neutrogena Clinical at night, about 20 minutes after putting on your retinoids.
Patients who've used this have reported to me is a noticeable smoothing effect to the surface of the skin. And you do experience a slight tingling sensation that perhaps is the mechanism of these low-level ions and the electrical activity that it is inducing. When you're applying it, it's so smooth and it makes your skin feel so soft. It just feels good.
And so you're going to keep using it?
Yes, definitely, yes.
For Wrinkle-Free Friday, I'm Meg Ferris.
Doctors say as this technology evolves, it may be used in the future for patients who have had lasers, chemical peels, and for those who have had surgical wounds, burns, and skin ulcers.